So many people think that these things that they get, I'm always going to have it, and I'm probably told that, right? Well, this is nothing we don't know where it comes from. We don't know how to make it go away. You could have it forever. And that's really a shame because people then don't search for the answers. But then when it comes to this chronic stuff, we're like, oh no, we're just going to have that forever. No. That's not how the body works.
Welcome to Pivoting Pharmacy with Nutrigenomics, part of the Pharmacy Podcast Network, a must-have resource for pharmacist entrepreneurs seeking to enhance patient care while enjoying career and life. Join us as we pivot into nutrigenomics using pharmacy and nutrition for true patient-focused care. Explore how to improve chronic conditions rather than just manage them. Celebrate entrepreneurial triumphs and receive priceless advice. Align your values with a career that profoundly impacts patients. Together, we'll raise the script on health and pivot into a brighter future. Hello and welcome to Pivoting Pharmacy with Nutrigenomics. I'm Dr. Tamar Lawful, Doctor of Pharmacy and Certified Nutritional Genomics Specialist. I have a question for you. Have you ever felt like the cape you carry is heavier when you're weighed down by chronic health issues? The panic, the feeling of stuckness, and that exhaustion from keeping everything afloat, it's strenuous. While you were busy being there for everyone else, your body began a silent protest. The result, autoimmune diseases, chronic illnesses, and that persistent feeling of being off balance. It's high time you prioritize your needs. Wouldn't you agree? Today's episode is all about shedding that heavy cape and stepping into a light-filled arena of health empowerment. Our guest, Dr. David Bilstrom, is not just a fountain of wisdom, but also a beacon of hope for countless warriors battling chronic health conditions. Dr. Bilstrom is a distinguished fellow of the American Academy of Integrative Medicine and the American Academy of Medical Acupuncture. That's not all, friend. He is quadruple board certified. Yes, you heard me right. Quadruple in functional and regenerative medicine, integrative medicine, physical medicine and rehabilitation, and medical acupuncture. As if being our real-life superhero isn't enough, Dr. Bilstrom is the director of the International Autoimmune Institute and the Bingham Memorial Center for Functional Medicine. It's the first facility in the United States linked with a teaching hospital dedicated to treating all types of autoimmune diseases. Plus, it's a trailblazer in utilizing nature as an integral part of a wellness program. We're going to unpack how our daily choices can become our best allies in reversing chronic conditions. We'll explore the role of functional medicine, dig deep into the wonders of epigenetics, and shine a light on how our environment impacts our health. It's an honor to have Dr. Bilstrom as our guest today. So earphones in, world off, heart open. Let's dive right in. Dr. Bilstrom, thank you so much for joining us here on Pivoting Pharmacy with Nutrigenomics today. Can you take us back to your roots? What sparked your passion for the work you do today?
Well, originally, I was a spinal cord injury rehabilitation doctor. So everyone that I would see was paralyzed from the waist down or the neck down, and a very challenging population, including it really taught me so much about the gaps in treating people with chronic health issues because we have so much stuff going on. There's not a medicine for it or a surgery for it. And this really started about a 30-year journey where I was really going to figure out, why people get health issues and how you can help them reverse them once they get them, ideally preventing them, but reversing them once they're well established. And the last 20 years, because of the explosion in autoimmune disease, where just about everybody has it, so many chronic health issues that we didn't think were autoimmune disease actually are autoimmune disease, and it's a worldwide problem. And typically people are just treated with a medicine that suppresses the immune system, putting just a bandage on a couple symptoms, but actually not addressing the main thing that was causing it. And the people continue to get worse and got bad impact from the medicines themselves. And I'm like, okay, somebody's got to change the way that autoimmune disease is dealt with worldwide. And so I said, I'm going to be the person to spearhead that.
I love it. Thank you so much for explaining that, Dr. Bilstrom. You know what resonated with me, what you just said, was the reversal of chronic diseases, because many patients are diagnosed with these diseases and feel like they are going to be stuck with it for the rest of their life and don't realize that there are things that they can do.
So true.
And I know you're experienced in epigenetics. Can you tell us what epigenetics is?
Well, first off, it's fascinating. But what epigenetics is the things that change gene expression without changing the genetic code itself. And our DNA, our genes, there's a whole lot of bad genes, and we got to turn them off. And a whole lot of good genes we want to have turned on. When people are getting chronic health issues, and this is one reason why once you start getting one chronic health issue, it's so easy to get a second and a third and a fourth and a fifth, and it keeps going. Because what you're doing is you're turning on the bad genes and turning off the good genes in every cell in the body. And typically when we'll see somebody coming in, let's say like with an autoimmune disease, they got so many things going on at the same time. They got brain fog, they got memory issues, they got fatigue, they got insomnia, they got gut stuff, they got bing, all these other kind of things in addition to what maybe their main issues are. Well, every cell is being told the wrong information because epigenetically things are flipped the wrong way. And so in a perfect world, when we look at, well, what are we going to do to help this person? We're looking at a lot of things that will tend to work through epigenetics, because it's lovely because they start turning off the bad, turning on the good in every cell in the body at the same time, really putting their system in a position to get everything moving in the right direction at the same time.
So how exactly does that work to turn off the bad and on the good so that we can improve our health?
Yeah, so an example is that about 7 to 9% of the human genome is actually viral. Over the eons, viral genetic material has been incorporated in our genetic material. And a lot of it is so ancient, it's not even active currently, but there are some active ones already. So it's like, okay, well, we don't need viral genetic material making proteins that are going to make us sick all the time. So we got to turn that off, for example. And so there are reactions like methylation reactions, histone deacetylation reactions, these other kind of things that our body should be able to keep the bad ones turned off and the good ones turned on. And that's a great way to stay healthy long term, including when it comes to epigenetics. This has such to do with what runs in families, where it's not necessarily what genes you have that runs in families, it's which ones get turned on and turned off. And so if somebody can optimize epigenetics before conceiving a child, they're actually passing on cleaner genes to the next 6 to 8 generations. The corollary is if you don't optimize epigenetics before conception, you're passing on crummier genes to the next 6 to 8 generations. But this is also where we're the product of the previous 6 to 8 generations. And you may hear things like, we live the trauma of past generations, because they've had trauma, including things like adverse childhood events that have flipped their genes the wrong way. Well, that stuff just keeps getting passed down from generation to generation. And it's one of the reasons why we see so many sick kids nowadays having all this stuff going on that you didn't hardly used to see.
That's interesting. And so the trauma from past generations being passed on to future generations. And then I'm getting a sense that it's kind of like an additive effect, a cumulative effect, if it's not addressed and passed on. And is this largely, when it comes to epigenetics, related to environmental factors, or are there other factors that play a role in changing the genes?
You know, a lot is things like vitamin deficiencies impact epigenetics, hormone imbalances, infections, environmental toxicity, emotional trauma like the adverse childhood events, all kind of flip the genes the wrong way. And then that's what increases this risk of getting all kinds of health issues as time goes on. And ideally, if you can optimize epigenetics by age 19, you really set the system in a place where you just don't get stuff as an adult. All the original data was that, well, this is what happens with physical changes to the epigenetics. You got to set it. But then when all the data started coming out about adverse childhood events like divorce, separation, substance abuse in the household, somebody becoming incarcerated, physical, verbal, sexual abuse, trauma, all this kind of stuff, well, those lack the epigenetics. And if you can really get them turned back around, optimize epigenetics after those events before age 19, you really prevent them from getting chronic disease as an adult. My wife is a psychotherapist, and she's an expert on adverse childhood events. So we end up lecturing a lot together. So particular interest to both of ours. But this is where it'll drive, not only autoimmune disease, but cancers and all kinds of chronic health issues. So it's so important to be able then to start addressing this, knowing that the things we need to address, like autoimmune disease to reverse it, is going to be working a lot through epigenetics. But also, when we see a parent with an autoimmune disease, we always want to see the kids. Because the data is clear that when a parent has an autoimmune disease, the children have a huge increased risk of every autoimmune disease, which is a good example of how there's not just like hundreds of different autoimmune diseases. There's really one disease that can attack any body part. Thus, the children are so much more likely to get any autoimmune disease. We'd like to prevent that from happening. Or when a child, and we're fortunate enough that we see children from every state in the US and adults too, but also 21 time zones worldwide with autoimmune disease. We see the child and start reversing their autoimmune process. We want to see the parent, because a child may get their autoimmune disease before the parent gets theirs. But we know just this epigenetics runs from generation to generation. So we want to be in a position to prevent it if it hasn't happened yet, but also reverse it if it already is well established.
Wow, this is very interesting. And I'm going to have you talk about autoimmune disease, but I want to backtrack because you mentioned like resetting children's epigenetics before the age of 19. So we have generational like trauma and it's being passed on, right? But now you're saying that if there's some things that can be done before the age of 19 to like reset the epigenetics. So what kind of interventions are we talking about? What are we looking at?
So what we talk about when it comes to all this chronic disease, either reversal or prevention, we talk about the 7 central mechanisms. Mm-hmm. And so the gut is the first. The gut's a real big central mechanism for everything goes on in the body. The second is the stress hormone cortisol, which always gets kicked up into the stress mode when there's enough going on that we start getting these health issues. The third is these infections. I talk about them being the hidden infections because there's infections that give obvious infections are like fevers and these kind of things. There's other infections that drive chronic disease. And these may be bugs that get in from the outside, mycoplasma, herpes virus 6, for example, Coxsackie viruses. It could be ones that get in our body, everybody's body, like Epstein-Barr virus, and sits there dormant. And you do not want the immune system to let it ever get active because then it drives things like Hashimoto's thyroiditis, multiple sclerosis, all these things. Or you can get bad bugs from the gut, including adenoviruses, that can translocate through a leaky gut into the bloodstream, go all over. And then these adenoviruses can go to the breast tissue and increase breast cancer risk, go to the pancreas and stop the pancreas from making insulin. The vitamin deficiencies and hormonal imbalances and deficiencies, environmental toxins are another one. Food sensitivities, where the guts become leaky, that intestinal permeability disorder, and it creates food sensitivities, both immediate, that people go, geez, every time I eat this, I don't feel well. They can figure it out themselves. But the delayed hypersensitivity reactions, the IgG reactions, they call it delayed hypersensitivity. You eat a certain food protein and it whacks you by creating inflammation days later or up to even a month later. So those are kind of those sneaky foods. You put all that together, it drives chronic disease of all kinds, including these are the kind of things we want to correct so we can start flipping the genes the right way in every cell of the body at the right time.
Yeah, that's a lot of factors and interventions that can be made. Right. And I'm curious to know, especially when it comes to the children, how early can these preventative measures begin?
Well, ideally, you want to start them before conception. So Ideally, you'd like to optimize epigenetics in people before they conceive a child. And then during pregnancy, there's so many things you can do to optimize the developing child's, avoid neurologic diseases, like things you do in pregnancy to decrease the risk of autism and developmental delay, get the brain and the nervous system to optimize. And then there's things you can do early in life. The kind of earlier you do something in life after a person's born, it not only puts them in a good position not to get stuff as a kid, but it really sets their system at such a young age that it really impacts their health their entire life. Ideally, hey, I'm never going to get that stuff, or, oh my gosh, I got this huge increased risk my whole life kind of thing. And we see children like with juvenile rheumatoid arthritis, 5 months of age, the cutest little baby with a knee the size of a basketball, and those kind of things. It really can start early. One of the nice things is children are so good at healing that they're in a position to really turn this stuff around much easier than an adult would.
Yeah, it all makes sense now why you have little ones that have just entered the world, just started life, presenting with these diseases when you start understanding epigenetics. Right. Now, we didn't mention a lot about autoimmune disease. So could you explain to us exactly what is autoimmune disease and why does it happen?
Yeah, so the immune system is this beautiful example of how the body likes balance. We don't want to be too high or too low in anything. So like blood sugar. But on the immune system, when you lose that set point right in the middle of the immune system, you actually move away from it up and down at the same time. So the overactive immune system issues are all the autoimmune diseases, but also things like allergies, asthma, and eczema. And then the underactive immune system issues are things like colds and flus and infections, and getting the same infection over and over again, like you'll see with kids with recurrent ear infections, strep throat, sinus infections, these kind of things, the infections that drive chronic disease, and then cancer risk. And this is where you hear things like cancer is just a flip side of the same coin, this autoimmune disease. And everything you do to bring this immune system back to the middle to get rid of the up stuff like autoimmune disease, you're getting rid of cancer risk at the same time. And so the traditional autoimmune disease is the part of the immune system called the adaptive immune system, where you make antibodies specifically to attack certain specific proteins or things. So if an infection comes in, there's proteins on the cell surface. We make antibodies against that specific protein to kill that infection. Because you get a cold, we don't need to have a cold for the next 20 years. 3 days later, you want to be over it. But then the adaptive immune system can become confused and actually make antibodies attacking our own body parts. And then by attacking that own body part, it destroys the body part. So like things like Hashimoto's thyroiditis, which is one of the autoimmune thyroid diseases, you attack the thyroid antibodies, you anger the thyroid, and it stops making thyroid hormone. Or you attack the joints, you get rheumatoid arthritis, joint destruction, you attack the brain, multiple sclerosis, other kind of things like that. And so this confused immune system is actually causing us to basically like self-destruct. If you're attacking your body parts, you're self-destructing, and it's never going to be a good idea to self-destruct. Now, we also know that the other part of the immune system, the innate immune system, is so important at getting rid of inflammation, keeping away the inflammation that then hurts body tissues, causing chronic disease as well. And so, for example, like in type 1 diabetes, it's not antibodies typically attacking the cells in the pancreas that make insulin and destroying them. What it is we can't get rid of this excess inflammation, and the beta islet cells to make insulin just shut down. They go dormant. And so that's kind of cool because we don't have to like rebuild healthy tissue to do the work. Mm-hmm. We just got to wake up dormant cells to make insulin. So this is where like people with type 1 diabetes, they can have insulin pump therapy 10, 20 years. Those cells in the pancreas are still sitting there dormant. All you got to do is wake them up, kind of a thing. So this is where the immune system is so much a part of all these health issues, including all the traditional ones that people maybe heard about. But we now know there's an autoimmune component to so many health diseases like heart attacks and strokes and osteoporosis and Parkinson's and Alzheimer's, dementia. Even 70% of all autism is one particular autoimmune disease. So it's really, we kind of seeing where this immune system is such a big player in health in general.
Thank you for explaining that, Dr. Bilstrom. I know we were talking before the show, and I was letting you know that I'm coming across a lot of people letting me know that they've recently been diagnosed with autoimmune disease. Mm-hmm. And it seems like it is growing at an alarming rate. Why do you think that is? Why is it growing?
Well, it's kind of like all the things that drive the immune system disruption are just becoming more and more common. So like, for example, environmental toxicity. Our world is so toxic. We have a bunch of messed up guts, so much use of early antibiotics, whack the intestinal microbiome, totally destroying the gut. Motrins and Advils hurt the gut. Metformin kills the gut, creates a leaky gut. Metformin also alters epigenetics in a terrible way. And a lot of medicines like the acid-blocking medicines mess up the gut and all these kind of things. And stress. We live in a very stressful world. Even stress messes up the gut. And then we get, the gut's disrupted. Well, then we can't absorb nutrients from our food. And we start getting vitamin deficient. And so many people eat such poor quality food type things, like the highly processed and the fast foods. They're not even foods. I call them food-like substances. So they don't even have nutrients in them.
Right.
And then we get all these hormone imbalances because when the gut's off, we start getting all these hormone imbalances, including a huge one that drives autoimmune disease and a huge one that drives cancer. There's something called estrogen dominance. Mm-hmm. And so this hormone imbalance, estrogen dominance, is so common nowadays. It's one of the big reasons why 80% of people that get autoimmune disease are women. So this estrogen dominance, which is too much estrogen now in the progesterone, drives all the hormonal menstrual things. So bad flows, bad cramps, PMS, PCOS, fibroids, endometriosis, fibrocystic breast disease, infertility. That's all estrogen dominance. But also because estrogen revs and progesterone calms, it drives all this rev without calm stuff in women, like excessive worry, anxiety, panic attacks, insomnia. And when you look at that, you're like, well, a few generations ago, women, they just had their cycles every month, regular, no big deal. All of a sudden, at one age, they stopped having their cycles. That was menopause and over. But nowadays, this estrogen dominance, because of all this stuff going on, is so common. It's almost like, well, what woman doesn't have this hormonal menstrual stuff? What woman doesn't have excessive worry, anxiety, insomnia, or even panic attacks? It's so common, but this is such a huge driver of this disruption of the immune system. 80% of people that get autoimmune disease is women, but also cancer is the flip side of the same coin as autoimmune disease. Women with estrogen dominance premenopausal have a 5.4 times greater risk of getting breast cancer before menopause. Not twice the risk or 3 times, 5.4 times greater risk of breast cancer before menopause, and a 10 times greater risk lifelong of malignant neoplasms, the ones that metastasize, the worst of the worst. And so all this stuff that we're talking about creates this estrogen dominance. And then this estrogen dominance is a huge driver of disease in women. But what we're trying to do is educate people what these hormonal menstrual things and red without column things truly are, because they all stink. You don't want any of them. Unfortunately, the things that tend to get used to treat them actually make it worse. Like, oh, you got all this hormonal menstrual stuff, we'll put you on birth control pills, oral birth control pills, but they're estrogen based. So they make it worse. And then, well, now things are so bad, we got to do a hysterectomy. Well, the change in the anatomy down there, any change in the anatomy, even if you leave the uterus and you take one ovary out, even a tubal ligation messes this up. Any change in the anatomy makes the estrogen dominance worse. You may get rid of the bad flows and cramps because you don't have a uterus anymore, let's say, but you made it worse. And so this is really driving chronic disease in women, including this huge impact on cancer risk and autoimmune disease.
Oh, thank you for sharing that and breaking down those different components that are driving forces for this increased rate in autoimmune disease prevalency. Now, we talked about you mentioned medications, how they can actually cause more problems, more diseases even. And now you have a protocol to help your patients that is not associated with medication side effects like traditional treatments. Could you delve into your approaches that set you apart from conventional treatments?
Yeah, I tell you, could I maybe focus on the ones that work through epigenetics? So like that stress hormone cortisol. So we always talk about we got to get rid of the things that are causing physical stress, because the stress response in the body, that fight or flight mode, life or death mode, is typically designed to deal with intermittent stress, like emotional stress. It's not designed to deal with 24-hour a day, 7-day a week physical stress. The body stress is stress. Physical, emotional, spiritual, it's just all stress. So it kicks cortisol up into the stress mode, gets stuck. And then you can't fix anything. It's one thing after another. So we get rid of all these physical stressors, then cortisol can reset into the calm mode. Mm-hmm. But typically, your body's forgotten what calm feels like. So we got to create calm. So this is where things like meditation and deep breathing and repetitive prayer and progressive muscle relaxation is so important, because by resetting cortisol, telling cortisol what calm feels like, we're in a position to fix everything, including 16 years ago, there was 2 different studies that suggested that meditation works through epigenetics. And so Harvard, kind of being Harvard, goes, well, we're Harvard, and we're not going to believe anybody else's research. We're going to do our own. We'll get our top researcher on it, and we're going to see if this is true. Well, they took this huge group of people that had done daily some kind of relaxation between 3 and 27 years. Another group that never did it, they checked their epigenetics, and they saw about 2,000 genes expressed differently between the 2 groups. And I go, okay, so you guys have never done this. We're going to teach you meditation. And we're going to ask you to do it 30 minutes a day, 5 days a week, for 8 weeks, and then we're going to retest you and see if anything's changed. Well, human nature being what it is, even Harvard can get people to do it perfectly, even for 8 weeks. So on average, the people did it 15 minutes a day, 3 days a week for the 8 weeks. But they saw that 2,000 of the genes that had been expressed differently initially, 400 had flipped to match the long-term people after just 8 weeks. And they go, that is so cool. What do? They're the genes that code for inflammation or lack thereof. And they go, oh my gosh, this is exactly what you want to do for everything. Now, because the gut's such an important mechanism, the vitamin D receptors in the gut can become resistant to vitamin D. And vitamin D receptors are in every cell in the body. One of the things that makes vitamin D so important, but the receptors become resistant, just like you can get insulin resistance. You may have insulin, can't attach and do the work. But when the vitamin D receptors in the gut go resistant, it is a super central mechanism in the gut and everything else. How you fix it is with what I call the foundational triad: daily vitamin D, daily probiotics, and daily butyrate. So butyrate is a short-chain fatty acid made by the good bacteria in the gut. It's actually tested for on the digestive stool analyses that we do, the stool test. It's so important. And when you do that, it optimizes the intestinal microbiome. It's rid of the gut producing its own inflammation. This is where the gut is can become the engine of inflammation. It's actually making its own inflammation, such as the pro-inflammatory cytokine NF-kappa beta. And then the lining of the gut starts making antimicrobial peptides to keep bad bugs down long term. And by doing that, all the original data was, oh my gosh, this is what's going to fix all autoimmune disease. But oh my gosh, this is what will fix everything. And sure enough, major depressive disorder, people become more outgoing and social, nuclear weapon is metabolic syndrome. And so big central mechanism. But butyrate almost exclusively works through epigenetics. And this is why butyrate not only can help lungs heal in kids with cystic fibrosis, helps brains recover after stroke, prevents cancer 5 ways, actually kills cancer 5 ways, all this other kind of really cool stuff because it works through epigenetics. And then another thing that we use an absolute ton is made by the liver called the bile acid, but also called the chaperone molecule called TUDCA. So it's tauroursodeoxycholic acid. For the pharmacists out there, they might know the precursor called UDCA. It's urodiol, that they use for gallbladder sludge and gallbladder stones.
Right.
So this TUDCA, oh my gosh, it works through epigenetics. It's huge. But also it gets at the central mechanism of all this huge increase of things called civilization diseases, because all this stuff we're talking about that drives chronic disease creates inflammation in the endoplasmic reticulum in the cells. And that endoplasmic reticulum stress creates misfolding of the proteins that are being produced there. And that misfolding of protein creates civilization. All these things you're seeing so much more now than used to. TUDCA as a chaperone molecule chaperones it through the production process so it doesn't get misfolded. Oh my gosh, that is a huge central mechanism. Everything you see so much of nowadays has to do with this misfolding of proteins within the endoplasmic reticulum. This TUDCA as a chaperone molecule, oh my gosh, is this huge, including as part of that med. Now, you guys know more about this than I do. The med that came out for ALS about 2 years ago, that's a combo of TUDCA and butyrate, increases lifespans by people with ALS by 40%. Super low dose, though. Gosh, you could take 2 bottles of the TUDCA for what it costs 1 capsule, basically. But even the pharmaceutical industries are kind of seeing where these naturally occurring compounds are not only so important for neuroinflammation, thus they think this TUDCA is going to be this absolute game changer for the epidemic of neurodegenerative diseases like Parkinson's, Alzheimer's, dementia, Lou Gehrig's disease, but is tied into type 1 diabetes and obesity and cancer and blood pressure and cholesterol and all this kind of kidney disease and liver disease. It is a super central mechanism. Once again, it works through epigenetics, but then also it's a super cool chaperone molecule as well. So this is where you get the body in a position it really starts fixing all this stuff, especially when you're kind of using the language the body likes to use.
What you were explaining with the folding, is that the Bilstrom's nuclearitis that you were referring to? Or is that something else?
Oh, thank you. So Bilstrom's nuclearitis is when your immune system is confusingly making anti-nuclear antibodies, ANA. So ANA is a blood test. And if you get a positive anti-nuclear antibody, you're making antibodies against your nuclear material. It's an autoimmune process, right? But historically, that was considered a not fully formed autoimmune disease. And, well, we don't really have a name. It's not fully formed yet. We don't know what to do. We're not going to do anything. What that means is you're going to get either rheumatoid arthritis, lupus, Sjogren's, mixed connective tissue disease, something like that. So probably within 5 to 7 years, you're going to start attacking other body parts, other parts of your DNA, and we'll tell you got these guys. But 5 to 7 years later, you're like totally worse already, right? And all this. And so you look at that and you go, well, why would we wait to treat something that you're saying is not a fully formed autoimmune disease? Obviously, it's an autoimmune process, it's autoimmune disease. Well, we don't just go, oh, well, you don't have fully formed diabetes yet, so we're not going to do anything. We're not going to do it. We're going to wait until you're fully formed diabetes, then we'll do something. Well, you're like, well, why wait? So I'm like, well, okay, so what we got to do is we're going to put a name on this. So we're going to name a positive ANA, Bilstrom's nuclearitis. Now we got a name. In medicine, if we don't quite have a name for something, I'm not quite sure what to do a lot. But now we're going to treat it, and we're going to turn it off before it ever gets to the point of attacking other body parts. But we're not going to use medicines that just suppress the immune system, because that's not getting rid of autoimmune disease. That's just suppressing a few symptoms. What we're going to do is actually treat Y and make it go negative. And then, because whatever made the ANA go positive is tied into every other thing you're not feeling well about, whether it's the fatigue or the brain fog or whatever, we'll get all this to reverse. Now the ANA goes negative. We did our due diligence to rebalance that immune system. And now you're not going to get rheumatoid, lupus, Sjogren's, or as it turns out, you're not going to get cancer either, because we're now taking care of the reason why we're at such a high cancer risk.
Absolutely amazing. So I'm curious, because we're talking about, we know that from region to region, genetics vary, environmental factors vary as well, lifestyle varies. So given your experience internationally, have you by any chance noticed any cultural or regional differences in health perceptions regarding epigenetics?
Yeah. And so in kind of the European areas, there's very similar genetics from one country to another, but depending on lifestyle and all these other kind of things, it can really alter how much autoimmune disease you get. And so, one thing they'll see is the darker somebody's skin tone, the harder it is to make vitamin D. And so people like from Somalia and other parts of Africa that have moved to like Scandinavia, for example, they tend to get a lot more of this autoimmune stuff than the people that live there. And one reason is, even though it's virtually impossible to make adequate vitamin D from sun exposure nowadays, humans just are terrible at that. Even the lifeguards in San Diego are about 40 points lower than they should be, is when you can't make really any vitamin D from sun exposure. Even that little drop is a big deal, especially when you got this vitamin D receptor resistance. You don't got vitamin D, you don't got good receptors, you're really in a bad place. And so that kind of tells us, the environment really makes a big difference in all this stuff. And so then you tend to see sort of like the multiple sclerosis band around the world with the northern climate, far away from the equator. Vitamin D drops just enough that you get this huge increase in multiple sclerosis, but it's also other autoimmune diseases as well. But then the lifestyle, so in countries that are developing nations and they're starting to eat the really crummy food-like products, they're starting to get more stressed. They lose their traditional communities, their traditional support groups, all this kind of stuff. Then they start getting all these chronic health issues going on, including the autoimmune stuff. And so the world that we live in makes it so challenging to stay healthy. But one of the nice things is we now know that, so we should be able to go out and go, okay, well, you're going to be very challenged, but we know how to keep your genes flipped the right way. We know how to keep your gut healthy and all this kind of stuff. We're going to do a much better job of preventing it before it happens. Or because we know where this stuff comes from, we're in a position to start making it go away, even if it gets well established.
Yeah, that's interesting. So location matters, but you and your team have the tools to help people with autoimmune disease reverse and get better. I want to definitely talk about another portion of something you've developed, the Nurse Practitioner's Guide to Autoimmune Medicine. Can you tell us about that and how this resource could potentially help other practitioners as well?
Yeah, so our ultimate goal is to have somebody in every community who knows how to do this. Because if there's not somebody in the community who knows how to do this, the community thinks, well, we have no idea where this stuff comes from. Or, well, then the community doesn't know we have any way to reverse it, right? And so we really want people to know that we know where this stuff comes from, we can reverse it, and having somebody in the community, I think, is going to be that answer. But so this is where we have the book that it really is a book about the basics. I think if you know the basics of the science behind this, you could do like 70% of what we do in our clinic right from the get-go. So it's a book that says, well, why is this important? Why is autoimmune so huge in an epidemic? Exactly what causes it, exactly what tests to run, exactly how to interpret the data from the tests, whether it's blood tests, saliva, stool tests, that kind of stuff, exactly what interventions to use, exactly what doses of interventions, exactly when to retest to see if it's working or not, exactly what to do if the labs change or don't change, and exactly what to do to maintain it long-term. And then we also have the autoimmune parrot. We have two different levels of courses actually for medical people, including one that's CME credit. That's the autoimmune paradigm, where we take a super deep dive into all this stuff, ideally trying to get somebody in every community that is the expert in reversing and preventing autoimmune disease, and kids and adults and multiple generations through epigenetics.
I think that is vital. It's important because many practitioners out there really do not understand it. And their first go-to, of course, are the medications, or patients go through years of being undiagnosed. No one really knows what's wrong. Autoimmune disease, it presents in so many different ways. It's hard to pinpoint. So yeah, I think that's great that you're doing to have some practitioner in every community to have that goal that really understands it and knows what to do.
Because truly, if you know the science, and this is what I always talk about, well, the body's super, super complicated, but it's super, super logical also. So if somebody knows the logic behind this, they can really do it. One of the quotes I have in my book was a physical therapist I was seeing I do extreme snowboarding and I hurt myself. Not all snow is soft. And trees are definitely not soft. So we were talking, and I was telling him about, how I think if you know the basics, you do 70%. He goes, well, yeah, what you're talking about is masters know the basics well. Masters do the basics well. I'm like, that's right. If you can master the basics, you become the master. And this is where it's so easy to get caught up in all this sort of interesting inflammation. But if you don't know the basics, a foundation of basics, you'll never become the master. But if you know the basics, you are the master already.
That is a great point, because sometimes just knowing the basics, understanding that the details are so much easier and simplified when you know the foundation. That makes a huge, it's like with nutrigenomics, knowing the basics, the foundations, you get it pretty easily as well. I have one more question for actually two more. With your work, it emphasizes preventing and reversing autoimmune diseases, of course, using the principles of functional medicine. Are you able to share a patient case with us where there was a transition?
I can share thousands. Yeah. So how about I give you a quick one where the body is so good at healing. No matter how long we've had something, the body's always trying to fix it. It knows how to fix it. The default mechanism of the body is always to move towards wellness. So if you can't fix something, something's gotten in the way because your body is trying to fix it. So this happens a lot. One particular person I think of is she was 84 when she came to see me, and she had all these health issues, including autoimmune disease. When we started talking about all our different symptoms, and I asked her specific questions, everything that happens tells part of the story. We got to her ringing in the ears, her tinnitus. And I said, so when did your tinnitus start? Oh, it started when I was 6 years of age. I've had that forever. I'm kind of used to it. You got to get used to it. So I don't particularly worried about that, but I got these other things, right? And I'm like, well, no, everything's connected. And sometimes it's the things that happen first that really tell you where it came from. And then you go, okay, I can see where that came from. But then it's like logical, bink, 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 bink. And these are all the things you get, including by age 84. So we made a couple food changes because she had autoimmune disease. We know everybody with autoimmune disease process have a delayed hypersensitivity reactions to the proteins in wheat. There's 62 different kinds, gluten's one, and the proteins in cow's milk dairy. Butter is okay. Butter is actually the only food source of butyrate. That's super important thing. The gut needs to be healthy and everything else. And so we said, well, let's go wheat, gluten-free, cow's milk dairy-free. We know infections are part of all this. So we're going to start you on this fantastic broad-spectrum antimicrobial we get out of Canada called pH structured silver solution, which is a nano silver that will get rid of any infection, no matter where it's at, whether you know it's there or not, including, I just did a video a couple weeks ago about how it gets rid of malaria. It gets rid of the adenoviruses that translocate from the gut to the breast tissue to cause breast cancer and to the pancreas to create type 1 diabetes, gets rid of those guys, all these things. There's also, though, this cool structured water portion of this pH structured silver solution that is the cool biophysics of water molecules. I'm totally like geeking out here. And allows you to get rid of inflammation and help damaged tissue heal, including studies show it works through epigenetics in skin cells, like with burn injury patients. Wow. It would get the burns, not just to get these infections, but they'd heal faster. They go, wow, how does that happen? Turns out the structured water upregulates the activity of 59 out of the 88 genes in a skin cell that code for skin cell healing. Makes it more active. It's like, oh my gosh, that's so cool. So we did those two things. She came back 6 weeks later, going over all her labs. And I said, hey, you anything feeling better? She goes, well, yeah, my energy is a little better. And I think my brain fog is a little better too. Not a lot, just a little bit. And I go, okay. I said, what about the tinnitus? And she stops and goes, oh my gosh. I've had that since I'm 6 years of age. And I'm looking at my notes. I go, yeah, I see it. That's why I asked you. And she goes, oh my gosh, it's gone. I've had it since I was 6 years of age. I can't believe it. It's not there anymore. And I'm like, this is a great teaching moment.
Amazing.
Because no matter how long you've had something, your body is always trying to fix it. It knows how to fix it. And if you can get that, whatever it is, out of the way, the body goes, hot dog, I finally have my chance to fix this. And the body just rolls forward. It's incredible how the body can heal when you kind of know the language it speaks.
Amazing. I know she's 80 something, so over 70 something years she's dealt with ringing in her ears. That is amazing in just a few weeks.
So many people think that they, these things that they get, I'm always going to have it, and I'm probably told that, right? Well, this is nothing we don't know where it comes from. We don't know how to make it go away. You could have it forever. And that's really a shame because people then don't search for the answers. But truly, when they realize, it's kind of like when you walk around your house barefoot and you stub your toe, kick a chair leg, and you're hopping around in like tremendous toe pain, and you're trying not to cuss in front of small children. Well, everybody inherently knows their body can heal because they're not thinking, I'm going to be hopping around in terrible toe pain for 50 years.
Right.
Like, well, my body's going to fix this and I just won't do it again. But then when it comes to this chronic stuff, we're like, oh no, we're just going to have that forever. And like, no, that's not how the body works.
No, not at all. It wants to heal. It wants to heal and is looking for a way. My final question for you, Dr. Bilstrom, is you noted in your bio, and you mentioned recently that you like snowboarding, also hiking when you're not practicing medicine. How does this passion for nature tie into your belief in its healing power when you're treating patients?
Yeah, so nature has been shown in dozens and dozens and dozens of studies to improve human health and well-being. Now, the central mechanism appears to be that cortisol reset. And so when you get out in nature or even interact with nature, it has this powerful impact on cortisol and powerful impact on our immune system and inflammation control and all this kind of stuff. And so we teach patients how to use nature to heal. And we kind of set it up like a bullseye. So like the inner bullseye is what you might do in your home. So like gardening, home gardening, in your own home has been shown to help human health and well-being reset cortisol. Looking out the window at nature has been shown. Local parks, like in big cities, local parks, that's been shown to help human health and well-being. Getting out into greater nature, and kind of where I'm at, we're surrounded by like national parks and all this, helps human health and well-being. So no matter where you are, or no matter how sick you might be and how easy or hard it is to access nature, you can access nature, and then this really gets the healing process going.
Wow, nature, the healing power of nature. You know, I'm supposed to be going tomorrow to go hiking in a sequoia, so I'm going to remember this.
Oh, well, yeah, I think you know what I mean. You come back and you're like, I feel like a new person. Oh my gosh, right? Including, they did a study on post-cholecystectomy patients. They got their gallbladder removed. And if the recovery room overlooked a green space, they had a shorter length of stay, less post-op complications, including less post-op infections, just by looking at a green space. Mm-hmm. And so this is where you see hospitals where they'll maybe have like pictures on the ceiling or the walls in recovery rooms of nature scenes, because all this data came out a long time ago, and they go, hey, this is easy. We'll just put up nature scenes. And that even works too. That's
what we need, some nature. Well, maybe I'll do a mural in my room. Nature scene as well.
Well, you got the sequoias. I don't know if you could beat a sequoia.
Or just open a window, open the blinds. I'll see the mountains outside. Oh, wow. It's been a pleasure, Dr. Bilstrom. Thank you so much for this enlightening conversation and the knowledge that you've been sharing with us. We appreciate it so much. It was a pleasure having you on the show.
It was my pleasure. My pleasure. Thank you so much.
And there wraps another power-packed episode with knowledge blossoming in our hearts and hope kindling a brighter tomorrow. A massive thank you to Dr. Bilstrom for joining us today and gifting us a roadmap towards wellness that feels achievable and sparks joy. Remember, dear friend, your health is not a destination, it's a journey. And sometimes journeys have bumps and detours. It's okay to pause, to seek help, to change course. What's important is that you're on the move, one brave step at a time. Feel motivated to take action? Muster your courage, strap those boots of resilience, and tackle next week with the wisdom you gained today. Think how far you'll have traveled all this time next year. And if you nodded along to this episode and feel like it could inspire someone, please share it. Let's spread this empowering ripple effect, because we rise by lifting others. Coming up next week on the show, we're diving into the groundbreaking world of recovery techniques that don't require a gym membership, so you can supercharge your healing journey without stepping out of your comfort zone. Talk to you next Friday. Until then, always remember, in your journey as a healthcare professional, always raise the script on health, because together we can bring healthcare to higher levels.